Good day, you guys. Welcome back to the channel. And before we get into the topic for today, I'd like to tell you a little about the channel's title and why I named it so. So, as you guys already know, the channel is called Compage Medicina, which is a Latin word that means framework of medicine. So, essentially, the channel's namesake is the reason for which I created it. I would like to give you guys a framework or a structure for each topic which would help you to remember it. So the idea is that the frameworks I provide are arbitrary, which means I made them and I would intend for my viewers to remember the topics through those frameworks, but you guys can go about presenting them in any way that you like. That is essentially how I would go about it. So now, with that out of the way, let's get into the topic for today. Today's topic is management of epistaxis. So it would be unfair to epistaxis if we don't speak about the blood supply of nasal cavity. So essentially, the nasal cavity takes its blood supply from two systems, the external carotid and the internal carotid. Now, the internal carotid has two main branches, the anterior ethmoid and the posterior ethmoid arteries. The external carotid, however, has a much more branched out network, the initial branches of which are the facial artery and the maxillary artery. The facial further gives a few three branches, which are the lateral nasal artery, ascending palatine artery, and the superior labial artery. Now, coming to the maxillary artery, the main divisions from it are the greater palatine and the sphenopalatine artery. Now, from the sphenopalatine artery, there are two other branches, which are the lateral nasal branch and the posterior septal branch. Now, at postgraduate level, it might be good if you remember one more step beyond this, is that the posterior septal artery gives off what is called a nasoseptal artery. This nasoseptal artery is the artery on which we base the Haddad flap. The Haddad flap is a pedicled flap which is considered to be the workhorse for anterior skull base reconstructions. So that is all about the blood supply. Now coming to the management of epistaxis. Before we go to the algorithm, it would be better if we have a structure upon which we can base that algorithm on. So we go for what is called the lines or levels of management. There are four levels essentially. First level is called the direct management or direct therapy, which essentially includes bipolar, cauterization, and it could also involve endoscopy. Now the second level is called the indirect therapy, which includes anterior nasal packing. Third level is called surgery. This level includes endoscopic, sphenopalatine artery ligation. The last and fourth level would be embolization, which is essentially an interventional radiology technique. Now, bearing this framework in mind, we now go to the algorithm. As in any emergency situation, we begin with resuscitation of the patient. And then we perform an initial exam. During this exam, we look for the offending vessel, which may or may not be found at this stage. So, if it is found, we go for the direct therapy. And with direct therapy, it might be settled. The bleeding may be controlled. Now, if the vessel is not found at this stage, we can perform endoscopy. And using endoscopy, the vessel may be located, and thereby we go to direct therapy again. Let's say if the vessel is still not found with endoscopy, we can move to indirect therapy, which includes anterior nasal packing. And if there is a continued bleed beyond this stage, we can use posterior packing, septal surgery, and vessel ligations. Now, let's consider that even beyond this stage, the bleeding still continues. At this level, we have to bear in mind that there might be secondary factors that are causing the bleeding, and we need to look for them. And the management that we can provide at this stage would be angiography and embolization. That is essentially the algorithm for epistaxis management. And that concludes the topic for today. Thank you all for watching, and like, share and subscribe, you guys. Have a good day.